An introduction to radiotherapy for prostate cancer. What is radiotherapy? Radiotherapy is the treatment of cancer using radiation. How is radiotherapy given? Radiotherapy can be given externally or internally. External beam radiotherapy is given to the outside of the body using a machine called a linear accelerator. Brachytherapy is a specialized type of radiotherapy that gives the treatment inside the body using radioactive sources. Some people may have external beam radiotherapy followed by brachytherapy. If you will be having both treatments, your oncologist will have discussed this with you. A member of the brachytherapy team will meet with you during your radiotherapy and explain the treatment to you. What is external beam radiotherapy? This is the treatment of cancer using high-energy X-rays given by a machine called a linear accelerator, or LA for short. The X-rays are targeted precisely to the specific area that needs treatment. Radiotherapy is like having an X-ray taken. You don't feel anything. You will hear a buzzing noise the machine is on, and the machine will move around you but does not touch you. While you are having your radiotherapy, we will ask you to keep still and try and relax and breathe away normally. You will be watched all the time by the radiographers, and there is an intercom system. You will not be radioactive, so it's safe to be around babies, small children and pregnant women. Before starting your radiotherapy, we would ask you to try the following suggestions. It is really important to drink plenty and remain hydrated. We should all be drinking about 2 litres a day. When you wake in the morning, make sure you have a drink to replace any fluids lost during the night. Try and reduce your caffeine and alcohol intake. This is because they can irritate the lining of the bladder and may cause you to need to pass urine more frequently. If you are well hydrated, it also helps with the position of your prostate, as the prostate can move depending on your bladder and bowels. Being hydrated can also help to reduce any side effects. Even if you need an empty bladder for your treatment, it's still important to drink plenty throughout the day. If you have been more active, or if it's a warm day, or if you're having lots of hot sweats, then you need to drink more to replace the fluids you have lost from perspiring. Drinking plenty can also help if you're prone to getting constipation. We ideally need you to be able to empty your bowels every day before your treatment. Prehabilitation is a way of preparing yourself for your radiotherapy. It can help to reduce how the side effects may affect you, and can also help with your recovery following the treatment. Prehabilitation involves both pelvic floor muscle exercises and bladder training. Pelvic floor muscles are a band of muscles that run from the pubic bone under your pelvis to the base of your spine. They provide some voluntary control over the muscles that affect the bladder, bowel and sexual function. Radiotherapy, hormone therapy and surgery can cause some weakness of these muscles. By strengthening these muscles before starting treatment, it may reduce the impact of possible side effects. You can do these exercises while you are having a course of radiotherapy. Continuing to exercise these muscles can also help to improve your recovery from any bladder or bowel side effects. These could include a reduction in urinary frequency, urgency, leakage, or dribbling before or after passing urine. They can also help to reduce the number of times you may need to get up at night to pass urine. There can also be benefits to sexual function. They can help with your ability to get an erection, the length of time an erection can be maintained, and the quality of the erection. Information on how to do your pelvic floor muscle exercises can be found on Prostate Cancer UK website. You can either download or print the fact sheet, or you can visit the Linda Jackson Macmillan Centre at Mount Vernon Hospital and pick up a copy. Bladder training. Bladder training can benefit everyone regardless of whether you need to have a full or an empty bladder for your treatment. The radiographers at your planning appointment will explain to you if you need to have a full or empty bladder. Radiotherapy can make you pass urine more frequently and with some urgency. You may find it more difficult to hold on as your treatment progresses. Training your bladder before you start your treatment can help to improve these side effects. Bladder training will help you to hold more urine for longer periods of time. It's possible to train your bladder to do this gradually by increasing the time between each visit to the toilet. We would ask you to stop the training during your radiotherapy, but start it again about 2 months after completing treatment. There is more information about bladder training on the helpful hint sheet 303 called Radiotherapy for Prostate Cancer. This is available on the Linda Jackson Macmillan Centre website. Follow the links for patient information and then prostate cancer. Fiducial markers. Some men will need to have fiducial markers inserted into their prostate for their radiotherapy. If you need to have these markers, your oncologist will have discussed this with you. The prostate is a very movable organ, and for your radiotherapy we need to ensure we are treating the correct area each day. One way we can do this is by using fiducial markers. Fiducial markers are tiny 22-carat gold pellets that are smaller than a grain of rice. Before the radiotherapy planning, there will be an appointment to have the markers inserted into the prostate. Before each radiotherapy treatment, an X-ray picture is taken so we're able to confirm the exact position of the prostate by looking at the position of the markers. Not everyone is suitable to have these markers. This may be due to prior surgery, certain medication, or because they will be having brachytherapy. In these situations, we check the position of the prostate each day using a slightly different method of imaging. It's very important that you tell the hospital if you're on any medication that thins your blood or stops your blood from clotting. Please call the radiotherapy assistants as soon as possible on 07825 024 683 or 07825 024 170. You will need to stop taking this medication before you have the procedure. You will be advised when to stop. If you do not let us know before your appointment, we may not be able to do the procedure. The procedure for fiducial marker insertion. In order to have the markers inserted, you will be positioned lying on your back in the lithotomy position. The procedure is similar to a biopsy, but less uncomfortable as we are not removing any tissue. Some people can have some discomfort during the procedure, and for this reason we would recommend you take 2 paracetamol tablets 30 minutes before your appointment time, if you can. The markers will be inserted through your perineum. The perineum is the area between your scrotum and your back passage. Because we go through the perineum and not through the rectum, the risk of infection is very low, so antibiotics are not necessary. Side effects. Some people may have some side effects. You may find the area where the markers were inserted feels bruised and tender for a few days. Some people may see some blood in their urine or in their semen. This should settle within 24 to 48 hours. If you are asked to stop any blood thinning or anti-clotting medication, you can restart them 24 to 48 hours after the procedure, as long as any bleeding has stopped. If you have any questions following this short film, please contact the Linda Jackson Macmillan Centre on 020 3826 2555, who will either be able to answer your questions or will signpost you to the appropriate team.